We are joined here today with Dr. Michael Moreton. He is the International Medical Coordinator at the Bangkok Dusit Hospital. Dr. Moreton has delivered over 8,000 babies in his time as a doctor and has a lot of very interesting viewpoints on the medical industry in Asia, particularly where technology is going and primary healthcare. Welcome, Dr. Moreton.
Dr. Moreton, welcome. I guess my first question is, what's the same with patient care and what's changing in the new landscape?
Well, certainly one hates to be condescending towards Asia, but certainly some of the changes which have happened in the more developing countries are now happening in Asia. For instance, patients are getting better informed, the patients are getting more inquisitive, patients are asking more questions, patients expect to be included in the decision-making process. When I was younger in my career, I think our relationship, the doctor's relationship with the patient was a good more arrogant than it is now. We would decide what form of treatment was necessary for the patient and would tell them, and we were not used to our decisions being questioned, whereas now that is quite different. One tends to suggest different avenues of approach to patients, what are the pros and cons of various lines of treatment. And certainly in Asia, where the relationship between the doctors remains somewhat more of the master and servant, these changes are now happening, particularly in the well-educated, more urbane Asian patients. And so I think that people like me have a chance to bring some of the Western experience to Asia and to help this process along. Certainly patient care in essence is always the same. I mean, it's human beings looking after human beings, and all the technology, the CAT scanners, the MRI scanners, these must always remember that these are just tools. These are just instruments in helping the medical doctors and nurses and all the hospital personnel make better decisions on helping the patients. But in the end, it's still a very one-on-one person-to-person relationship, and that has not changed, and God knows I don't want it ever to change.
What do you think from being at the symposium this morning, some of the topics being discussed, what struck a chord with you and what did you find discordant?
Well, yesterday actually we had a workshop and we were talking about Asian matters, and certainly my theme, which was taken up by the workshop, was about the importance of establishing a good primary care system. For instance, in Britain, in Canada, and Australia, there's a very good system of family practitioners. Your first line of defense there, you go and see your family doctor. And then secondary care, that's the everyday treatment of things in the hospital, and then the tertiary care, the 3 levels of care. And you cannot build a good health care system by building it from the roof down. Yeah, and I find at times that people go to the more developing countries and they see the wonderful cancer centers and see wonderful cardiac care centers, and they're very impressed by that. And I think in some ways they're impressed by the wrong thing. In other words, they should be impressed if they go to your country, Australia, in seeing the fine system of family doctors, that everybody has the access to a primary care doctor and can go in and see these, however remote the part of the country is, that there's always a good, well-trained family doctor there. I think that is what we need to establish in Asia, that in every little town and village and every island there should be a clinic. They don't have to be stocked by doctors, by the way. Good nurse practitioners can do this, and that's where we start, with a good firm foundation, and then build on top of that foundation.
And do you think that, I mean, some of the things we've heard about are there's money for equipment purchases but not for maintenance. Do you think that the healthcare systems in a lot of countries really need addressing in the region?
Well, no, that is a feature I'm not sure whose fault that is. Is it the companies who don't provide enough technological support? But another point about the technology is it's all right to buy a piece of machinery, but do you have personnel who are skilled in using the machinery? And more important than that, do you have personnel who are skilled in interpreting the data that the machinery is producing. After all, an MRI scanner, which is perhaps the most sophisticated tool we have at the moment, produces a number of images, a number of pictures. Somebody has to look at those pictures and interpret the pictures. And although there are computer-generated programs that can, to some extent, read the pictures, it really needs a human being who's been well trained in that. So there's several. When you order any test, there are four real pieces of the process. One is the ordering the correct test. Secondly is doing the test. Thirdly is interpreting the test. And then fourthly, conveying to the patient in language which they understand the results of the test. Now, only one of those four elements involves the machinery. So there's three other elements involved which are very human elements.
And finally, is there anything you'd like to close on?
Well, you know, I find this sort of meeting very invigorating, I work in the Bangkok Hospital in Bangkok, which is a tertiary care hospital, and it's pretty much a 5-star hospital. We have patients coming particularly from the Middle East, all over the world, and it's really good to get back. And here today at this meeting, we're talking about grassroots medicine. We're talking about bringing medical care to people in the Asian countries who are not getting good medical care, and that is very invigorating to be talking about those things.
Thank you.
Yeah.